Thank you, Britton. Today we are talking about how important it is to brush our dog's teeth. And Dr. Bert Gaddis is here along with our regular Dr. Jerome Williams. Gentlemen.
It's so good to be here. You know, this is Dental Month.
It is?
Veterinary Dental Month. And we're fortunate to have one of the foremost veterinary dentists in the country.
Certainly in Birmingham.
I put you on the spot, yeah. Put you on the spot, Eddie. But you are. And so you've brought your friend with you here today. Who is this?
This is Gracie.
Hey, Gracie. So chances are a lot of us don't brush our dog's teeth.
Probably
to.
Probably about 95% of the pet owners don't.
Why is it so important?
Well, brushing your pet's teeth removes the plaque, which we all feel in our teeth when we wake up in the morning. That eventually calcifies or hardens and forms tartar. But it's that bacteria in the plaque that causes gingivitis, that eventually causes periodontal disease and tooth loss.
So you're letting things happen that don't have to happen.
Right.
Okay, so we've got some pictures, I do believe, looking at cleaning. Now, you can do this at home, but you don't use human toothpaste.
No, well, no, you use a pet toothpaste or just a dry toothbrush. Here's
this is a regular cleaning, right?
Video of a cleaning with a pet under anesthesia using an ultrasonic scaler to remove the tartar.
So that's what's built up on there.
Yeah, that brown that's coming off as the tip is going across it. That's tartar.
Oh my goodness! Now I would imagine they have to be put to sleep, obviously.
Yes,
because they do not.
And that stuff goes beneath the gum line. That's what really creates the problem over the longer term.
And so chances are, I guess, Dr. Gaddis, you don't know there's a problem until there's a problem.
Right. And many times we don't know the problem until we get them under anesthesia and can use the little periodontal probe to go around the teeth and find where there are pockets from the periodontal disease. It's not evident looking in their mouth because the gums haven't receded. Okay,
so you can brush your dog's teeth, but do you need to still have a cleaning done by a professional? Obviously, once, how often?
Well, it varies from dog to dog.
Oh, boy, that's a big difference.
Yeah, that's a nice before and after with extractions and so forth. That dog, I'm sure, within a few days felt like a new dog because of the infection that was no longer in the mouth.
So they are feeling something that they can't tell us they're feeling?
Yes, they tend to hide pain. That pack mentality, they don't want to show that weakness because they're in your pack and they don't want you to throw them out of the pack, which is what happens out in the wild.
Doesn't that break your heart? All right, so sometimes when someone brings a pet to you, do you see that, hey, this, you need to have this looked at by someone like Dr. Gaddis?
Oh yes, when there's a serious disease like this one,
right.
I think this is one of our patients that were referred to him because the requirements were beyond our expertise and we needed a specialist like Dr. Gaddis to do it.
So what starts happening to the pet as it goes on?
Well, there are many associated problems, heart problems, kidney problems that can be associated with bad dental disease because that infection, which is what it is literally just a few cell layers away from the bloodstream. So their bloodstream's getting showered with bacteria every time they're eating or using those teeth. So
it's really the same thing with humans because we know sometimes dentists have discovered an underlying problem for an adult, right?
Right.
Or anyone. So what are we looking at here?
That's a dental x-ray of one of those teeth that we extracted where we're pointing to an area where there's no bone around that root. That's literally an abscessed root and that tooth was just floating. So we know how bad a toothache is for us. That's what the animal's feeling. It is. It is, and trying not to show it. Many times, until it's very advanced, they don't show it.
That breaks your heart.
A lot of clients will call us, or we'll see them back on recheck, and they'll say, that tooth that I didn't think was hurting, or that I didn't think my pet was in pain, I'm seeing him, running and playing like he hasn't done, or playing with chew toys they thought that they didn't like.
Okay, we've got to wrap up, but quickly, when you bring it, can you tell? I mean, do you touch it, and can you tell what's going on, even if you don't think there's a problem there? Can you?
My best advice for viewers out there would be to lift your pet's lip and look in the mouth, and if you see a lot of brown sandpaper-like staining, you need to see your veterinarian to have that evaluated. It's often very difficult to tell how extensive the dental disease is until we get in there and can clean the teeth and take dental x-rays to look at the other half of the tooth.
Dr. Bert Gaddis, thank you. Dr. Williams, good to see you.
Oh, it's good to be here.
And what a sweet puppy.
Thank you.
All right, we'll be right back by checking in with JJ.